So, good day, Ma'am Lyra. My name is Jonas C. Villanova, and on this video, I will be performing Leopold's Maneuver, a return demonstration. So, Leopold's Maneuver, it is used to systematically palpates the gravity uterus, and it is an easy to perform, easy to perform, um, easy to perform because this is a non-invasive method, and it is for to determine the position, presentation, and engagement. So the equipment that we'll be using here is our stethoscope, our pillow, and for a towel. And now we're going to proceed on the procedures. First is we must do a medical hand washing. This is to deter the spreads of microorganisms that is in our hands and the transmission of microorganisms onto our patient. So and after that we're going to introduce ourselves, identify the patient, and explain to the patient about what we're going to do. So, come in here, ma'am. So, good day, ma'am. My name is Jonas Lee, your student nurse for today, and I'm going to ask you, ma'am, what's your name? Kate. So, ma'am, hello, ma'am, Kate. How are you? How are you today? Okay, thank you for that wonderful answer. So, what we're going to do here, ma'am, is I'm going to examine your abdomen, and and this is what the procedures that we're going to use here is have some sorry. The methods is called here is the Leopold's Maneuver. So Leopold's Maneuver is to determine the position of the fetal baby. So that's one. And now we're going to let the before doing the other procedures, we must first let the patient void first and emptying her bladder. For this is to provide comfort when we are assessing the patient, or we are doing the procedures. Is that, ma'am? So, what do you prefer? I'm going to ask you, ma'am, if you prefer an open door or closed door.
Closed door.
Okay. So now we're going to put the patient on a supine position, and knees slightly flexed, and exposing the abdomen. Nah. Yeah. Sibuk fokus. Knees are slightly flexed because this is to provide comfort, and there's some tension to prevent the tension of the knees. And now we're going to put a pillow under her head. Ma'am, use this pillow, ma'am. Thank you. And towel. And we're going to put a pillow, a towel under his right hip. We're on the opposite position, but this is for video purposes that I must be clear with the video. And if we are on the right, if we are right-handed, we must be under the patient's we must on the patient's right side. So now I'm going to expose the abdomen, and in exposing, we must ask the patient for any discomfort. So, ma'am, I'm going to ask you, ma'am, I'm going to expose your abdomen, ma'am. So, if you have anything to say, or if you are uncomfortable, just let me know, okay? Okay. Now we're done. So we are to move on the first procedure, which is the fundal grip. The fundal grip is we must face on the we must be face on the we must face the patient and palpates the patient's uterine fundus to determine to determine the fetal head or the fetal breech. Determining the fetal head or the fetal breech, the head is hard and round, or the breech is soft and nodular. For the second maneuver, which is the umbilical's grip, umbilical's grip is we need to palpate downward direction on the abdomen's beside on the beside on the abdomen to determine the fetal extremities, back and anterior shoulder. By determining, we must be gentle, but with deep pressure. And to proceed, we are now on the third maneuver, which is the we're going to proceed on the third maneuver. We're just going to place our hand on the symphysis pubis and and by determining the legal segment is we put our thumb and fingers to in the part of the in the part of the lower uterine segment to determine if any engagement has occurred. Now for the fourth maneuver, which is the pelvic grips, is this is done by determining the method in the third maneuver, and to define and to determine any cephalic in the cephalic prominence. Now cephalic prominence determines cephalic prominence if the cephalic prominence is on the same side with the head. With the cephalic prominence is on the same side, determined flexed, and on the cephalic prominence, we on the same side with the back, it is determined extended. So now I'm going to proceed listening to the fetal heart tone. And now, after determining it, we're going to fix our patient. So, ma'am, okay na ma'am. Um, all the procedures, ma'am, are you at comfort or discomfort?
I am.
Okay, ma'am. So I have listened to your baby's fetal heart rate, and your baby is at the right side position, right side position, and your baby's fetal heartbeat is over 130, which determines us this is normal. So that is all, ma'am. Thank you for your cooperation. And after all the procedures, uh, we will do the hand washing method, and we document, and that is all, ma'am. Thank you.